My name is Will Randy. I'm one of the prosthodontists here at Bedford Center for Prosthodontics. And as a prosthodontist, one of our areas of expertise are replacing missing teeth prosthetically. And what I want to focus on today is a topic in which we look at the replacement of all of a patient's teeth, or at least half of your teeth, maybe all of the teeth on the top or all of the teeth on the bottom. It's an unfortunate thing that we have to do, but it's a great service that we give to our patients because it really can restore your confidence and your quality of life when it comes to oral health care. So when we're talking about replacement of missing teeth, we really have three options in which we can look at to replace your teeth. Two of those three options are options that every night you're going to have to take your teeth out, okay? And then there's a third option in which you do not take your teeth out. The only person that can take them out is me. So let's start by talking about the two options in which we have to take our teeth out. The first and foremost is probably the most simple, and that's just a standard denture, okay? That's your grandmother's denture, all right? There's nothing holding that denture in. It simply is going to sit on your gum tissue and allow you to function. And at the end of the day, you're gonna have to take those dentures out and clean them. The other option is an option which is still removable. However, we're going to be placing some dental implants, and those implants are gonna act as anchorage for a removable appliance. And basically what those implants are gonna do is have a little button on them, and the denture is gonna have the reciprocating part of that button on it, and you'll be able to snap it in. That's probably what you've heard of or heard people referring to as snap-on dentures. Now those are great because they do give you a lot more retention of your dentures. The dentures are going to stay in a lot better and move around a lot less, increasing your chewing efficiency. You know, on the top, it's a really great service because what we're able to do in comparison to a standard denture that covers the roof of your mouth, when we have enough implants in the top, we're now allowed to remove all of that palatal plastic. So when you take your tongue and touch the top of your mouth, you'll actually be touching the skin on the roof of your mouth, not a big plastic denture, okay? And those are great for patients that don't want to take that next step or want to be able to remove their teeth at the end of the day and clean around them. And it's a really great service that we give to patients. Now the next step up is something that you do not take in and out, okay? That's the type of scenario where we're replacing your teeth with prosthetic teeth that are screwed into implants. Now we like to refer to that as an all-on-X procedure. You might have heard of it as an all-on-4 procedure. We don't like to get bound up into the numbers of how many implants we put in because we're going to place as many implants as what's best for the patient. I'm not going to pigeonhole myself into saying I'm placing 4 implants when I think 6 is going to be better for the patient. That type of prostheses is going to most closely represent not only the look and the feel of natural teeth, but also the function of your natural teeth. And as we move from a denture, which is removable, up to say a denture which is held in with some implants that's also removable, and up to a prosthesis that doesn't come in and out, we know from a lot of research that the patient's quality of life greatly increases as we move up that scale. So we hope that that's a good amount of information for you, and we'd love to have you come by the office to explore those options in a little bit more depth.